Hello, I'm Ken Mill. Do you love reading the literature and critically appraising the medical literature as much as I do? Probably not. And that may be why CAEP asked me to be the Tract chair for the recent EM literature at this year's CAEP conference. Now, there are 3 objectives to this track. The first objective is to raise awareness. How can you practice at the top of your level if you're not aware of the latest and most impactful emergency medicine literature? And so we want to make sure that you are aware of what's new in the field of emergency medicine when it comes to the literature. The second thing that we want you to learn as an objective is to how to critically appraise a paper. Now, just because it was published in, CGEM, doesn't mean it's necessarily true. You still have to probe the literature for its validity. And we hope to provide you with some of those clinical skills and abilities in this track. And the third objective is to be skeptical. Now, it's not nihilism, it's not denialism, it's healthy scientific skepticism. The time to accept a claim is when there's sufficient evidence to accept the claim. So those are the 3 objectives for the EM literature track at CAEP 2021. We want to raise awareness about the recent literature. We want to have you learn some critical appraisal skills and, of course, encourage skepticism. I've assembled 3 amazing medical educators to answer the question, what is some of the latest and most important emergency medicine literature? These are international, award-winning experts on critical appraisal and knowledge translation. They will provide you, the CAEP audience, with high-impact information. The speakers will filter out that signal from all the noise and cut that knowledge translation window down from over 10 years to less than 1 year. The ultimate goal, of course, is from this CAEP track, you will get patients the best care based on the best evidence. Joining us from the US, we have recent Society of Academic Emergency Medicine FOMED Excellence in Education Award winner, Dr. Lauren Westafer. She's a rising star in our profession. Lauren is an assistant professor in the Department of Emergency Medicine at the University of Massachusetts Medical School, co-founder of Foamcast, and social media editor and research methodology editor for Annals of Emergency Medicine. Dr. Westerfer's area of interest include pulmonary embolism and implementation science. Next up, we have pediatric emergency medicine superhero, Dr. Samina Ali from the University of Alberta. Her research is focused on improving the assessment and treatment of children's pain. Samina is currently an executive member of the Pediatric Emergency Research Canada Group, or PERC, and is a faculty member with the Pain in Children's Health. Dr. Ali is a pain content advisor for translating emergency knowledge for kids, or TREC. Now, rounding out this trifecta of fantastic international award-winning educators is Dr. Kirsty Challen. She's a consultant in emergency medicine and the emergency medicine research lead at Lancaster Teaching Hospital in the UK. She's also the chair of the Royal College of Emergency Medicine Women in Emergency Medicine. Dr. Challen's superpower is that she can take an entire paper and condense it and summarize it into one picture, which she calls a paper in a pic. And she does this for the Academic Emergency Medicine Journal. So let's go back to the objectives for this track, the EM literature track at CAEP 2021. The first objective is we want you to be aware of the recent EM literature. Second thing we want to do is we want to teach some critical appraisal skills. And the third and final thing is to encourage healthy scientific skepticism. I hope to meet you at the Forks on June 15th, 2021 and see Dr. Ali, Dr. Westafer, and Dr. Challen rise to the challenge. See you at CAEP 2021.